Fun Asia listeners, welcome to the second episode of DocTalkLive, a new health show brought to you by Dallas Renal Group in association with Zyga Healthcare Group and Fun Asia. We are live from the studios of Fun Asia. My name is Dr. Samir Nagya, and I will be co-hosting the show every week with Dr. Bryn Nicadia. Before we start today's show, we would like to introduce our sponsors for bringing the show to you every Monday between 5:30 and 6 p.m. to help create awareness in the community about health. Our first sponsor is Zyga Healthcare Group. They have been a leader in providing home health care and related services throughout the entire DFW Metroplex. They provide many services, and we will talk about how they can help you and your loved ones with diabetes. And our second sponsor is Dallas Renal Group, a physician group that Dr. Nicadia and I belong to. They're dedicated in providing compassionate kidney care to our Dallas community.
That's right. This is Dr. Bryn Nicadia, your co-host for Doc Talk Live. With support from our listeners in our community, we will continue to bring on doctors from various fields of medicine to discuss a topic that is utmost important for your health. Last week, we've discussed heart disease with Dr. Young Wen and Dr. Joshua Burek, and today we will be discussing diabetes. Remember to visit our website, www.doctalklive.com. That's DOCTALK live.com, and submit your questions for your next week's show. You can find more information on the website, including the topic that's upcoming, the guests that are going to be on the show, and their contact information. The website will also provide you a link to Zyga Healthcare Group as well as Dallas Renal Group.
Today's topic is related to diabetes. The number to the studio is 972-235-5555. Again, the number is 972-235-5555. Our invited guests will be answering your questions throughout the show today regarding diabetes. Today we have Dr. Forden and Dr. Garcia in the studios with us. They're both practicing endocrinologists in the DFW area. Welcome, guys.
Hello.
Thank you for taking the time to provide our listeners with education on diabetes.
Let's start the first question with you. So, Dr. Forden, tell our listeners, what is an endocrinologist and when should you see one?
Well, an endocrinologist is really an underpaid doctor. That's a joke, of course. There's probably no such thing as an underpaid doctor. Endocrinologist, you're board certified in internal medicine residency. And then after that, so after you complete your training as an internist, then you do a fellowship in endocrinology. For Dr. Garcia and I, that's 3 extra years after residency training. And what we train on is basically hormonal disorders. In particularly, our biggest disease is diabetes, but certainly thyroid issues, adrenal gland issues, pituitary issues, ovary, low testosterone, osteoporosis. These are all just a couple of the things that we deal with.
The other risks are, of course, history of family history of diabetes. So if a family member has diabetes, the risk is much higher. But it doesn't mean that one will necessarily get diabetes if one has family members. Having healthy diet and keeping weight under control is the key. And so staying lean is really the best thing one can do in addition to exercising.
Yeah, I'd like to add an older age. Diabetes is ageist. The older you get, the more likely you are to get diabetes. Certainly if you had a history of gestational diabetes or borderline diabetes in the past, you certainly are at very high risk of developing diabetes. And just to touch upon what Dr. Garcia was saying with South Asians, unfortunately being unlucky, is that diabetes is really associated with obesity, except that in South Asians you don't necessarily need to be that obese. If you have a lot of fat around your stomach and the abdominal area, that puts you at very high risk of diabetes. So for South Asians, it's more about how big your waistline is.
Okay. So what is the difference between type 1 and type 2 diabetes?
So type 1 and type 2 diabetes, we used to traditionally differentiate diabetes on whether you are on insulin or not. We called it insulin-dependent diabetes, which would be type 1 diabetes, or non-insulin-dependent diabetes, which would be type 2 diabetes. And then most of the people who got type 1 diabetes were children, so we called it juvenile diabetes. But these distinctions are really blurred today because type 2 diabetes is occurring in childhood, whereas people are on insulin even though they have type 2 diabetes. And so the big distinction between type 1 and type 2 diabetes is the cause of the diabetes. So in type 1 diabetes, it's an autoimmune disease where the body makes antibodies to your pancreas, which is where the insulin comes from, which lowers your blood sugars. Your body makes antibodies to the pancreas, shutting it down. Whereas with type 2 diabetes, your body makes plenty of insulin, it just doesn't work very well, and you're very insulin resistant. So type 1 diabetes, you definitely have to be on insulin. Type 2 diabetes, you could take pills, but you could be on insulin as well. So insulin is no longer a defining factor between insulin.
So, Dr. McCady and I, we see a lot of patients who have kidney disease with diabetes. Actually, it's the #1 cause of kidney disease in the United States. What are some other reasons why they should control their blood sugars other than developing kidney disease?
Well, so when blood sugar is elevated, tissues cannot function well, and the key here is that the blood vessels are unable to relax. So all the tissues are not able to get as much oxygen, as much nutrients. There is inflammation. So this results in neuropathy, heart disease, damage to the retina, the back of the eye, and can also lead to vision loss.
Yeah, so diabetes is, as you point out, the leading cause of dialysis and end-stage renal disease in the United States. But it's also the leading cause of blindness and amputations as well in the United States. But a lot of young people might think, well, that'll never happen to me. So I'll also hazard a guess that it's a huge cause of erectile dysfunction in the United States as well. And so it's very important to control diabetes so that you don't have these end organ damage because of it.
And all these are very preventable. It's just key to acknowledge that one has diabetes and talk to a doctor and make sure it's controlled.
Excellent, excellent. Folks, we're going to go into a short break in about 30 seconds. You're listening to Doc Talk Live here on Fun Asia, 104.9 FM. The number to the studio is 972-235-5555. Again, that number is 972-235-5555. Right after the break, we'll be taking calls live on air for Dr. Forden and Dr. Garcia. Stay tuned.
In response to Vidya's question, the data is definitely there in diabetics. So if you have a diabetic who loses weight, then certainly that's going to decrease the insulin resistance, and that's going to improve the blood sugar control. And certainly that's definitely true with bariatric surgery. With bariatric surgery, we've seen people have profound weight loss, and some people might actually tout it as a cure, but it's not really a cure. What it does is it just decreases your insulin resistance to the point of maybe you don't need insulin, or maybe you don't even need medicine anymore, but you're still quote unquote diabetic. Because once you get diagnosed with diabetes, perhaps 80% of your pancreas, your beta cell function is gone. And that's not going to necessarily regenerate or come back, even if you have bariatric surgery. So definitely the data is there in diabetics to say that's very beneficial. But as far as the prevention of diabetes, I wouldn't go so far as to say that there's studies to exactly prove that. But there's definitely studies to show that if you lose weight, if you lose 10% of your body weight, that could decrease your risk of progressing to diabetes by about 60%. So definitely the less visceral fat you have, the less abdominal fat you have, the better. That's certainly easier said than done. Dr. Garcia, did you want to add something?
So this is a very, very interesting question because it brings the fact that we still don't know a lot about diabetes. So what's known is that to become metabolically healthier, one needs to lose weight, whether that be through bariatric surgery or through diet. Either one is okay. However, if someone tries to lose weight by, for example, liposuction, or surgery where a surgeon opens the abdomen and removes what's called visceral fat, so fat that's on top of the intestine, that actually doesn't work. That does not make patients more metabolically healthy. So it doesn't seem that the intra-abdominal, the visceral fat, is the only answer here. It is much more complicated. So really staying lean and paying attention to your lifestyle, your diet is key here.
Well, logically, you would just think that all these things that we put in our food today, all these hormones, all these antibiotics, all these additives, that's not natural, that it probably isn't good for you. But can I definitely say that there's data to show that inorganic versus organic food is one that's superior to the other? No, I can't.
And it certainly can relate to stress. Stress increases a hormone called cortisol, and cortisol will increase blood sugar. And the other more complicated factor here is that a lot of people, when they're stressed, eat more. And when you eat more, that again can lead to obesity. But it is a combination of both not being able to produce enough insulin for the demand.
So in a short answer, no. Low testosterone won't lead to diabetes. Low testosterone can lead to increase in fat, which, as we were discussing, can then decrease your risk of diabetes. But certainly the opposite is true. Is high blood sugar, diabetes is associated with an increased risk of testosterone. And the treatment is really dependent upon the cause of the low testosterone.
Thanks, Dr. Forden. We have a few minutes left before our show comes to an end. We have Wes Cherion from Zyga Healthcare with us in studios. He's the head of public relations. What kind of services does Zyga Healthcare Group provide to its patients with diabetes?
Thank you, Samir. One of the services we offer, our home health can actually provide, is providing trained staff to come to your home and administer insulin shots, which also includes blood sugar checks, as well as we set up medication reminders, as well as report your results to your endocrinologist or the PCP. Like Dr. Forden Garcia was saying, diet management plays a major role in diabetes, so we go to an extent of educating our patients and caregivers the importance of diet control.
Thanks, Wes. Those are some great services that your company provides.
Thank you.
We're approaching the end of our show. Remember to log on to our website, DocTalkLive.com. That's DocTalk live.com to submit your questions for our next week's expert panel, which is Dr. Wagela and Dr. Minhas, who are practicing cancer specialists.
We have a couple of minutes before the end of the show. Dr. Forden and Dr. Garcia, is there any other information you would like to share with our listeners?
Yeah, I just wanted to stress the importance of getting your diabetes looked at and treated. Diabetes is a silent killer. You don't feel it, but it definitely can cause problems. And if you're interested, you can look at our website, www.techclinic.org, or our phone number, 972-CONTROL, for more information.
Yeah. And it is very, very important that you check with your doctor to find out what your hemoglobin A1C is. This is a marker of how diabetes is controlled. The goal is to have it less than 7 in most patients. Of course, it needs to be personalized for patients who are older or younger. But please find out what your hemoglobin A1C is from your doctor. And if it's not a goal, make sure that you're following your doctor's advice and consider seeing an endocrinology specialist.
Thank you. Once again, thank you, Dr. Garcia and Dr. Forden, for coming on our show. We truly appreciate the insight that you provided on diabetes to our listeners. As Dr. Nangia mentioned, next week we're going to have Dr. Wagela and Dr. Minhas. We're going to be discussing cancer. You can submit your question on our website, www.doctalklive.com, DocTalkLive.com, or you can call into the studio, 972-235-5555. Dr. Samir and I are signing off with the second episode of Doc Talk Live. See you next week at 5:30 p.m. on Mondays. Stay healthy, Dallas.